Witnessing a dog collapse into a seizure is an overwhelming experience. Inside the brain, a violent, misfiring electrical storm rapidly overtakes normal neural pathways, causing a total loss of physical control. Despite the thrashing and dramatic physical appearance, the dog is not experiencing physical pain. A seizure is a temporary period of abnormal, excessive electrical activity misfiring across the brain. These events are not random flashes, but follow a predictable trajectory through 3 distinct biological phases. Recognizing these phases provides a concrete framework for an owner to take specific, life-saving action. The first phase is pre-ictal, often called an aura. For minutes or hours before a physical event, a dog may show warning signs such as pacing, whining, or hiding, or seeking intense comfort as brain activity begins to alter. The ictal phase is the active seizure itself. If the electrical misfiring remains in one localized group of neurons, it is a focal seizure, appearing as subtle facial twitching. If the cascade spreads across both hemispheres, it results in a generalized grand mal seizure, involving a loss of consciousness and rhythmic paddling of the limbs. At the start of the ictal phase, immediately begin a timer and clear the area of furniture, stairs, or other physical hazards. It is physically impossible for a dog to swallow their tongue. Do not place your hands or any objects inside a seizing dog's mouth, as this significantly increases the risk of injury to both the owner and the pet. If the active seizure reaches the 5-minute mark, the dog has entered status epilepticus. This is a severe medical emergency where prolonged activity can lead to hyperthermia and permanent brain injury. A secondary emergency threshold occurs with cluster seizures, defined as multiple seizures happening in a row without the dog regaining normal consciousness in between. Accurate timing and careful environmental management are the primary methods for mitigating physical risk until the neurological storm passes. After the convulsions stop, the post-ictal phase begins. As the brain resets, the dog will likely experience severe disorientation, exhaustion, and temporary blindness. Once the immediate emergency is over, the focus shifts to a long-term investigation of the underlying cause. Veterinarians use a process of elimination known as a diagnostic funnel to isolate the root cause. The first tier filters out reactive causes. Blood panels and urinalysis rule out ingested toxins, metabolic disorders, or dangerously low blood sugar levels. The middle tier rules out structural causes, utilizing advanced imaging like an MRI to check for physical brain damage, tumors, or inflammation. When reactive and structural causes are eliminated, the remaining result is a diagnosis of idiopathic epilepsy. This condition is a presumed genetic predisposition to seizures rather than a physical injury or external poisoning. It is highly common, affecting approximately 1 in every 7 dogs. Arriving at this diagnosis provides the clinical confirmation needed to begin targeted, lifelong management. Success in long-term treatment is measured by a reduction in seizure frequency and severity while maximizing the dog's daily quality of life. Lifelong management typically relies on pharmaceutical tools such as phenobarbital, potassium bromide, or zonisamide to stabilize electrical activity in the brain. Firm anti-seizure medications must never be stopped abruptly, as this can trigger severe, life-threatening rebound seizures. Clinical diets enhanced with medium-chain triglycerides, or MCTs, can also support medication by altering brain metabolism to reduce neuronal excitability. An owner's most critical operational tool is a meticulous seizure diary. Tracking these specifics provides the data a veterinarian needs to adjust a treatment plan over time. Every household should have a written emergency plan that explicitly states when to administer rescue medications and exactly when to leave for the ER. With consistent medical control and careful monitoring, dogs with epilepsy can continue to live healthy, active, and joyful lives. Managing a dog's seizures involves moving from the uncertainty of a medical mystery toward a structured, predictable routine for both pet and owner.